The challenges facing the system are, on one level, unique to Canada, and on other levels, very consistent with many other systems. So let's deal with the unique challenges. We have, obviously, a federal system, and healthcare is primarily a provincial and territorial responsibility, and yet there is much the federal government can, and many would argue should do, to help move healthcare forward across Canada on a national basis. And finding that balance is something that many other federations have struggled with, and we have our own unique challenges because every federation is different. There's also the reality that from the standpoint of spending, we are above the OECD average by a fair bit. We've done well in cost containment recently, credit to the provinces and territories. But there's a limit to how much more I think Canadians feel we should spend. If you ask them whether they would spend a little more, many would say, okay. But we're getting near the limit of what makes sense compared to peer nations. And that means that with an aging population, which is another challenge, we will face more pressures, and we're going to have to adapt our system to deliver and accommodate the care needed for seniors as demographics begin to transform Canada. It's not just demographic challenges, though, that I think have to be considered. Technology is evolving in medicine. We're in a very interesting era where 15 years after the sequencing of the human genome, we're finally seeing new breakthroughs in molecular medicine, leading to what's being called precision medicine, the more precise delineation of drugs and biological treatments for a variety of conditions. Most of healthcare will still be evidence-based medicine as we understand it today. But I think in the years ahead, this movement to precision medicine, to more biological engineering of treatments, is going to make a big difference. And it will be very costly unless we're smart about how we implement and organize it. And you put all that together with a couple other challenges. One of them, obviously, is that those aging baby boomers, the ones who are going to be the seniors of tomorrow, have grown up in a pretty fast-moving culture. We grew up in a world where the pizza was there in 20 minutes or it was free. We're not accustomed to waiting around, and we're pretty firm about our prerogatives. I think in general there's a movement to consumer empowerment, but I think it will be accelerated and reinforced by the aging of the baby boomers, and we have to accommodate it. And roll in behind that this digital generation coming up, and the fact that many individuals of all ages are very comfortable with all forms of information technology. That information technology is going to change healthcare as well. We'll have wearables monitoring us at home with chronic diseases. We'll have virtual care provided by a range of health professionals. We'll be able to do things in the home that we could never do before in terms of healthcare. And in many of those areas, Canada is lagging. We don't have an organized plan for precision medicine. We're only starting to get our ducks in a row for the aging of the population. We're really not where we need to be with information technology. You put it all together and the view is, boy, this is not a time to have a system in stasis. This is a time for rapid adaptation to accommodate these challenges. And that's what Canada needs. It needs it quickly.